Anna, as Director of Programs and Services for Patient Care with our chapter in St. Louis, you have tremendous visibility into the services that we provide to support people with ALS. Could you start us off tonight just by telling us about those services that we deliver here locally?
Absolutely. Yes, I'd be happy to. I'm so excited to be here. I know this is kind of a new platform for all of us. We're sort of getting used to this whole digital atmosphere, but I think it gives us a really unique opportunity to connect in a way that maybe we wouldn't have before. So I'm really happy to be here. And if you could share my presentation, that would be wonderful. Thank you. As Josh mentioned, I'm Anna Zelinske. I'm the Director of Programs and Services for Patient Care for the St. Louis Regional Chapter. And before my screen came up and I saw names and faces, many of you are friends and colleagues and partners and know a lot about what we do. But I hope you learned something new. So I'm going to probably say some things that you all are familiar with, but hopefully you'll learn something new as well. So as I mentioned, we're the St. Louis Regional Chapter, and so we cover the just about eastern half of Missouri and the lower section of Illinois, the central and southern Illinois. And while our main office is here in the St. Louis area, where I am, our care coordinators are spread out throughout our catchment area in order to provide very specific services to people depending on their geographic location. If you could go ahead to the next slide, please. So I'm going to take some time to introduce our team so you can kind of get an idea of who it is that's behind our care services. As I mentioned, I'm Anna Zelinske, so I'm the director of the program. I oversee our advocacy efforts, our research, and also care services. And I'm also the clinic liaison for the Washington University Neuromuscular Clinic, which I'll talk about in just a little bit, but each of us on our team are a clinic liaison. And so I'm the partner with Washington University. And my colleague, Melissa Smith, she is the Associate Director of Care Services. About a year or so ago, we did a little bit of rearranging our department and created this position so that Melissa could have a strong role over care services, while I also oversaw advocacy and research. And so she oversees the care coordinators. She is an occupational therapist by trade, and then works with us as the Associate Director, and she's the clinic liaison for the John Cochran VA Clinic, our partner. Go ahead to the next slide, please. So this is our team. Lori Dobbs has been with our chapter for, excuse me, she's been with our chapter for about 10 years, I believe. She's been with us for a long time. And she is actually based out of the Cape Girardeau, Sikeston area and works with the St. Francis Medical Center, which is down in Cape Girardeau. And I saw a question about some details about the clinic liaison, so I'll get to that in just a moment. Then Melinda Osborne, she is a counselor by schooling, and also is the clinic liaison for the clinic that is in Springfield, Illinois. She's based out of Springfield, Illinois, so she's very familiar with the resources that are available there. And then Mary Love, she is a registered dietitian and also works as the clinic liaison for the St. Louis University Clinic, St. Louis University Clinic. And all of our team works directly with people who have ALS. Each of us work with people directly, whether that's at the clinic or also in the community. Services look a little bit different right now. I know our clinic partners have not been seeing patients in person, and that they're slowly kind of beginning to do that again. And we as a team are not doing home visits right now because of the concerns around COVID-19. So our services have definitely been impacted. But all of us as a team work really hard to try to provide the services that we offer to patients, whether it's over the phone or we've done virtual visits such as this. I know the clinics have done virtual visits, so we're working together to try to make the best of this situation. So I'll talk a little bit about what being a clinic liaison means. So each of these clinics is a different sort of type of clinic. The St. Louis University Clinic is a certified Center of Excellence, excuse me, as affiliated by the ALS Association. And then the VA clinic is a recognized treatment center. And then the Washington University and St. Francis and Springfield are all affiliated clinics. And so the ALS Association has a presence with those clinics. And as the clinic liaison, we are kind of the go-between. We can partner with the clinics. We see patients when they come to the clinics. If the clinic has recommendations for our services, we partner in that way and can help. Okay, if you could go to the next slide, please. So we know often when a person comes to our services, whether we meet them at the clinic for the very first time, or if they register through our services or just call us, we know that the journey has been very long and probably very tiring. And by the time a person has a diagnosis of ALS, they've been through a lot. And so our goal when we first begin working with a person is first to help them understand that they're not in this alone, that we are a robust team. We understand the disease. We understand the kinds of services a person needs when they're facing this disease. And we try from the very beginning to help people feel a partnership with us. And so these are a list of our programs and services I'll go over that are designed to reduce the impact of the disease. We know now we don't yet have a cure. We're working hard to try to find one. And so while we cannot fix this disease yet, what we can do is offer services to try to help reduce the impact. We also understand that when a person is dealing with ALS, they're dealing with loss of the use of their hands, loss of their voice, often. And with each loss, a person's world gets smaller and smaller. And so our programs are designed to try to open that world back up for that person, to give that person a voice, to help their caregiver be able to provide the services that their loved one needs. And these are the programs that we have in place to try to do that. So we do offer education about ALS and about the disease process. Often that education is through printed publications and resources. We rely on a lot of the publications that come out of national for that reason. We offer virtual support groups on a monthly basis. That's sort of a new thing that has come out of our new virtual world as we've been able to start these virtual support groups. Care coordination and case management, the team that I showed you before, we're all in a position to partner with a person, to help create a plan, to help match a person with the service that they need at the particular time in their journey. We work with the clinics and other community partners to help review a person's home and home environment and put systems or pieces of equipment or things in place so a person can stay in their home, they can stay safely, they can still access the areas of the home that they want to. We do that often through our durable medical equipment loan program. So a lot of times a person's waiting to be able to purchase a piece of equipment through their insurance. There's a waiting period, or sometimes a person wants to try out a piece of equipment. Often a piece of equipment isn't even covered by insurance. And so we have quite a large equipment loan program where we're able to get the right piece of equipment to the person quickly. We have a caregiver relief program that can help the person who's the primary caregiver have a break. We have a program that can help supplement some nutrition for a person who is unable to eat enough by mouth. We work closely with our advocacy initiatives and stay on top of research that's available. We're able to connect people with other community partners, people who offer services we don't offer necessarily, but we stay on top of what is available out in the community and connect people that way. We have connections with people who are agencies that provide palliative care and hospice resources. I mentioned that we have a connection with the VA clinic. We also have connections to help veterans make sure that they can take advantage of all of the services that are available to them as a veteran with ALS. We have a couple different speech and language pathologists that we work with in the community to be able to provide, either through our loan program, a speech generating device, or through one of our partnerships, we're able to connect them so that they can obtain the right piece of equipment through their insurance. We also have our Jane's Angel Fund, which is a grant program that helps provide for some incidentals, whether it's medical equipment. We've helped folks with home modification costs, with transportation. We've helped offset the cost of renting a vehicle or purchasing one through that fund. People apply for that grant, and it's something that we do on a quarterly basis to be able to meet the needs for people. And then, as I mentioned, the ALS partnerships at the 5 clinics that are in our region.